Today, we delve into a topic that is both deeply distressing and critically important within the field of forensic medicine, and it is child sexual abuse. Childhood ideally should be a time of innocence, wonder, and carefree joy. However, the harsh reality is that far too often, the innocence of children is shattered by the horrors of sexual abuse. This subject forces us to confront the darker side of our society, where the trust that should naturally exist between adults and children is betrayed. Child sexual abuse knows no boundaries. It transcends geographical, cultural, and economic barriers, impacting the lives of countless children across the globe. As future forensic practitioners, it is our solemn responsibility to engage with this issue head on, not only in the laboratory and the courtroom, but also as advocates for the most vulnerable members of our society. Hello and good afternoon to all of you. I am Maria Lourdes P. Magtaas, joined by Samantha Nicole Di Barreto, and we will be reporting about child sexual abuse. The content of the report will be the following. First is introduction, prevalence, types, grooming, child on child sexual abuse, warning signs, effects, and lastly, the key takeaways. Now, as we turn our focus to this challenging topic, let us begin by defining child sexual abuse. So, child sexual abuse is a form of child abuse that includes sexual activity with a minor. A child cannot consent to any form of sexual activity. When a perpetrator engages with a child in this way, they are committing a crime that can have lasting effects on the victim for years. Child sexual abuse does not need to include physical contact between a perpetrator and a child. And some forms of child abuse include, but are not limited to, exhibitionism or exposing oneself to a minor, fondling, intercourse, masturbation in the presence of a minor or forcing the minor to masturbate, obscene conversations, phone calls, text messages, or digital interaction, producing, owning, or sharing pornographic images or movies of children, sex of any kind with a minor, including vaginal, oral, or anal, sex trafficking, and any other contact of a sexual nature that involves a minor. Having established this crucial foundation, let us now turn our attention to a specific geographical context, which is the Philippines. In the Philippines, as in many other parts of the world, child sexual abuse is a pressing concern that demands our scrutiny and immediate action. We will explore the prevalence, causes, and consequences of child sexual abuse in the Philippines, shedding light on the unique challenges and efforts underway in this nation to address this critical issue. According to the Chameleon Association, about 7 million children are sexually abused every year in the Philippines. More than 70% of sexually abused children are between 10 and 18 years old, and among those victims, 20% are under 6 years old. Cases of child sexual abuse are one of the most common issues that the Department of Social Welfare and Development, or DSWD, has to handle after abandonment and neglect. And despite the anti rape law of 1997, rape remains the most frequent type of sexual abuse, followed by incest and fondling. 98% of rape victims are women, and the incest percentage is another alarming data, which is 33%. Most children who are sexually exploited for commercial purposes are victims of prostitution or pornography. To better understand this distressing phenomenon, it is essential to explore its root causes. Childhood sexual abuse is a complex issue with multiple contributing factors, and some of the key causes include first, social economic factors, wherein poverty and economic hardship can increase the vulnerability of children to sexual abuse. families struggling to make ends meet may be less able to provide a safe and nurturing environment for their children. Second is lack of education. Insufficient awareness about child protection, sex education, and the signs of abuse can leave children and their caregivers ill equipped to recognize and prevent abuse. Third is cultural and social norms. Cultural norms that prioritize authority figures and discourage open discussions about sexuality can make it difficult for victims to report abuse or for communities to take action against perpetrators. Next is family dysfunction. Dysfunctional family dynamics, including domestic violence and substance abuse, can create an environment where children are more susceptible to abuse and less likely to receive support when they disclose abuse. Next is access to technology. The proliferation of technology and the internet have created new avenues for child sexual exploitation, including online grooming and distribution of explicit material involving minors. And lastly, limited legal protections. Despite legal measures like the Anti Rape Law of 1997, the enforcement of child protection laws may face challenges, including issues related to corruption and inadequate resources. Now, we move on to the two types of child sexual abuse. So, the two main types of child sexual abuse is touching and non touching. Touching includes touching a child's genitals, making a child touch someone else's genitals, playing sexual games and or putting objects or body parts inside the vulva or vagina, in the mouth or in the anus of a child for sexual pleasure. Non-touching abuse includes showing pornography to a child, exposing a person's genitals to a child, prostituting or trafficking a child, photographing a child in a sexual pose, encouraging a child to watch or hear sexual acts either in person or on a video, and or watching a child undress or use the bathroom. So another related type of sexual abuse in children is grooming. Grooming represents a cunning and manipulative method employed by perpetrators to initiate and sustain child sexual abuse. It is a premeditated process where the offender establishes a trusting relationship with a child, their family, or caregivers for the explicit purpose of exploiting the child sexually. The goal of grooming is to gain the child's trust and manipulate their emotions, making them more vulnerable to sexual exploitation. Groomers often employ a range of tactics which may include showering the child with attention, gifts, or compliments, isolating the child from friends and family, and gradually introducing sexual contents or activities into their interactions. This calculated approach aims to desensitize the child to inappropriate behavior and normalize it, making it more challenging for the child to recognize or report the abuse. Understanding the intricacies of grooming is critical because it allows us to recognize the warning signs and equip children, caregivers, and communities with the knowledge and tools to protect against this predatory behavior. By shedding light on this aspect of child sexual abuse, we can better empower individuals and institutions to prevent and respond to these heinous crimes effectively. And now, to continue the report regarding the child on child sexual abuse, let me call on Miss Samantha Nicole Barreto.
Many parents often raise the questions concerning sexual abuse. Do children sexually abuse other children? And does it really happen? One uncomfortable fact about child sexual abuse is that about one third of all victimization occurs between people who are both under the age of 18, which means that child on child sexual abuse is a difficult reality that must be addressed. The term child on child sexual abuse is defined as sexual activity between children that occurs without consent, without equality, or as a result of physical or emotional coercion. What this means is that a power difference exists between the two children. whether that is in age, size, or ability. Adolescents between the ages of 12 and 14 face a higher risk of engaging in harmful sexual behaviors. These critical years coincide with the onset of puberty, bringing about numerous physical and emotional changes. If adolescents in this age range possess a distorted view of sex or a propensity for HSB, they may target individuals who are younger, smaller, or have cognitive or physical limitations. And while the trauma for the victim is the same as if it had happened by an adult, this type of abuse often goes unreported. And one significant reason for the underreporting of child on child sexual abuse is the tendency of adults to dismiss such incidents as innocent curiosity or exploration. Adults may not recognize the seriousness of the behavior or may underestimate its impact on the victim. This is often compounded by societal norms that minimize the significance of these actions, assuming that it's part of growing up. These dismissive attitudes from adults and society as a whole can discourage victims from coming forward, as they may fear that their experiences won't be taken seriously or that they'll face disbelief and blame for speaking out. Second, both the victim and the child displaying harmful sexual behavior often share a common fear: the consequences of reporting. The victim might be afraid of retaliation or bullying from the perpetrator or their peers if they disclose the abuse. And on the other hand, the child engaging in HSB may fear punishment, stigma, or legal consequences if their actions become known. These shared fears create a powerful deterrent to reporting child on child sexual abuse, contributing to a culture of silence that surrounds these incidents. The truth is that both children need help in a situation like this. The child being abused certainly needs the appropriate care to avoid the weight of lifelong trauma that so many survivors of child sexual abuse experience, as well as the symptoms that go with it. The child who has engaged in the harmful sexual behavior needs help as well. If they are able to see a licensed medical or mental health professional to help them work through this age inappropriate sexual behaviors, then they are less likely to engage in HSB again. Warning signs of child sexual abuse can vary widely from one child to another. Children may react differently to such traumatic experiences, making it crucial for adults to remain attentive and observant. In the next part of our discussion, we will delve into some common and diverse signs that could indicate a child is being sexually abused. Recognizing these signs early can be a critical step in providing support and intervention to protect our child's well being. However, it's important to keep in mind that having these signs does not necessarily mean that a child is definitely experiencing sexual abuse. Signs of sexual abuse in children aged 0 to 11 years can manifest in various ways, and one important indicator is changes in their emotions. So you might notice that a child seems scared or shows signs of anxiety, early childhood depression, school age depression, or preteen depression, is quieter or more distant than usual, cries for no obvious reason, starts to wet the bed or soil their pants, asks questions like, "Do people have to keep secrets?" Is aggressive or seems angry for no obvious reason, says their head or tummy hurts and there doesn't seem to be a physical cause, or starts having nightmares. Parents may also observe changes in their behavior. They might notice that a child isn't interested in playing or is avoiding particular places or people, is showing harmful sexual behavior, is having problems sleeping, or is eating more or less than usual and gaining or losing weight, or is doing less well at school and is reluctant to look after their personal care and hygiene, or starts behaving like a younger child. There could also be physical signs like swelling or redness in the genital area, pain when going to the toilet, difficulty walking or sitting, bruises on soft parts of their body like buttocks or thighs, symptoms of a urinary tract infection like burning while going to the toilet, or symptoms of a sexually transmitted infection like discharge from the penis or vagina. And having discussed warning signs in children aged 0 to 11 years, let's now shift our focus to recognizing warning signs specific to teenagers. So, parents may notice changes in their emotion. A teenager may exhibit various warning signs, which includes being aggressive or seems angry for no apparent reason, has headaches or stomach aches for which there doesn't seem to be a physical cause, becomes angry or upset when a particular person or place is mentioned, has trouble developing or maintaining relationship, cries for no obvious reason, has nightmares, has low self-esteem, or seems withdrawn or scared or shows signs of teenage depression or teenage anxiety, or is confused about their sexual identity. There could be there could also be changes in their behavior, such as dressing differently, has clothing, shoes, bags, jewelry, or electronics from an unknown source, or is showing harmful sexual behavior, including getting involved in risky sexual behavior, is taking risks, using drugs and alcohol, causing harm to others or self harming, and is driving erratically, or is spending a lot of time online and is secretive about online communications. Or they could also be eating more or less and is having problems sleeping. Aside from these, parents may also notice changes in their school and social life, as they could be seen spending more time on their own usual, has changed friendship groups, is avoiding particular people or places like a friend's house or a sports group, or is avoiding activities or events that they previously enjoyed, or ask questions like, do I have to go to music today? Or is doing less well at school. Physical changes could also be seen, which includes swelling or redness in the genital area, pain when going to the toilet, difficulty walking or sitting, bruises on soft parts of their body like buttocks or thighs, symptoms of a urinary tract infection like burning while going to the toilet, or symptoms of a sexually transmitted infection like discharge from the penis or vagina or a missed period. And now that we've explored the critical warning signs of child sexual abuse, let's now proceed to understanding the profound and lasting effects that such abuse can have on children and adolescents. Recognizing these effects is essential for providing the necessary support and intervention to those who have experienced this trauma. The following are some of the most common effects of child sexual abuse to its victims: emotional and psychological trauma. Survivors often experience emotional and psychological trauma, leading to conditions such as post traumatic stress disorder or PTSD, anxiety, depression, and feelings of shame, guilt, and low self esteem. Physical health consequences. Some survivors may suffer from physical health issues, including sexually transmitted infections, gynecological problems, chronic pain, and other health conditions related to the abuse. Behavioral problems. Child sexual abuse can lead to behavioral problems in survivors, such as self destructive behaviors, substance abuse, aggression, or difficulty forming healthy relationships. Sexual dysfunction. Survivors may experience sexual dysfunction, including difficulties with intimacy, trust, and sexual functioning. This can have a long lasting impact on their adult relationships. Developmental challenges. Child sexual abuse can disrupt normal developmental processes, leading to delayed emotional and social development, as well as impaired interpersonal skills. Self harming behaviors. Some survivors may engage in self harming behaviors such as cutting or substance abuse as a way to cope with their emotional pain. Dissociation. Survivors may use dissociation as a coping mechanism, disconnecting from their own thoughts, feelings, or memories of the abuse, which can affect their sense of identity and reality. Difficulty trusting others. Child sexual abuse can erode a survivor's ability to trust others, making it challenging to form healthy, intimate relationships and maintain friendships. Flashbacks and nightmares. Many survivors experience flashbacks and nightmares related to the abuse, which can be distressing and interfere with daily life. And lastly, the long term impact. The effects of child sexual abuse can persist into adulthood, affecting various aspects of a survivor's life, including their mental health, relationship, and overall quality of life. And to end the presentation, let me call on Ms. Maria Lourdes Magdaas for the key takeaways.
So the key takeaways are the following. Child sexual abuse is a significant issue in the Philippines, affecting millions of children each year. This involves any sexual exploitation or misconduct towards a child, such as rape, incest, and commercial exploitation. Poverty, lack of education, cultural norms, family issues, technology, and weak legal protections contribute to child sexual abuse. Child sexual abuse can be categorized into two main types, which is touching or genital contact, and non touching, which is exposure to explicit content or prostitution. Grooming is a manipulative process used by perpetrators to gain trust and make children vulnerable to abuse. Child on child sexual abuse involves sexual activity between children, often with a power imbalance. Warning signs can vary but may include changes in behavior, emotions, and physical health. And lastly, for our key takeaways, child sexual abuse has enduring effects, causing emotional trauma, physical health issues, and behavioral challenges. Survivors often struggle with trust, relationships, and recurring nightmares that can persist into adulthood. And that is the end of our report on child sexual abuse. Thank you for listening and have a good day.